Okay, let's dive into how doctors can spot a failing heart just by looking at a chest x-ray. It's all about finding what's called a wet heart, and they can do it surprisingly fast. They don't need a superpower. They just use a simple 5-letter checklist. Here's our roadmap for decoding that x-ray. So let's get right into it with A. First up, A is for alveolar edema. Put simply, this is fluid filling up the lungs' air sacs. You're looking for these fluffy white clouds. It's fluid backing up from the failing heart. And this pattern has a pretty memorable name, the bat wing opacity, a classic urgent sign. Okay, now for B, Kerley B Lines. These are much more subtle clues of fluid buildup. They're tiny, yeah, only 1 to 2 centimeters long, but they are a massive red flag. The key is knowing exactly where to look for them, the very bottom edges of the lungs. C is for cardiomegaly. In other words, the heart itself is abnormally enlarged. And there's a really simple rule of thumb for this. It's all about the proportions. Think of it like a strained muscle. A bigger heart is often a weaker, less efficient heart. All right, on to D for diversion. This is where the pressure inside the chest gets kind of crazy. So all that pressure actually forces blood flow upwards into the top parts of the lungs. So if the top vessels look bigger than the bottom ones, you know there's a backup. And finally, E is for effusion. This time, the fluid is leaking outside of the lungs. You'll spot this fluid pooling in the sharp corners right at the base of the lungs. So if those sharp angles look rounded and white, that's a dead giveaway fluid has escaped. And there you have it, the full ABCDE checklist, all pointing to an overwhelmed heart. It's how experts turn a confusing image into a clear, life-saving diagnosis.
It really makes you wonder, doesn't it? Sometimes the simplest tools are the most powerful ones.